So, welcome you all on this Friday evening to our today's session on training pathway. So, we were waiting for more participants to join in, and uh, sorry for the echo, since we are also doing a Facebook Live. Probably that's the reason. So, I won't bother you all to wait anymore. So I will invite Dr. Sufyan Mohammad Salauddin, consultant respiratory medicine, to start with the session, please.
Thank you. Good evening, everyone. So we'll start the session today. First of all, thanking DMC Club UK for arranging this session. I know that at the moment the specialty training and IMT training pathways are actually getting quite difficult to get in. It was a bit different about 4 or 5 years ago, and as we know that it's changing a lot. So I think these sessions where Dr. Sadman Saqib Rahman, who is an IMT2 trainee currently at Medway Hospital, and Dr. Amina Noor, who is a rheumatology ST5 trainee at Maidstone Hospital, will share their insights, as well as there will be some success stories from of some doctors who got into the specialty training this year. Hopefully this session is going to be helpful for all of us. Just a bit of housekeeping that I think we'll get all the questions in the chat section. So if there is any questions from anyone, please ask the questions in the chat sessions, and we'll try to go through the questions at the end of each presentation. So the whole presentation is going to be in 3 parts. The first part is the IMT training pathway, which is going to be presented by Dr. Sadman Saqib Rahman. And then there is going to be 5 minutes break. After that, there will be some success stories. We'll hear from some other doctors who is going to share their success stories, and followed by the specialty application pathway by Dr. Amina Noor, and then we'll finish the session after that. So I'll request first Dr. Sadman Saqib Rahman to present the IMT training pathway. Thank you.
Yeah, thank you, Dr. Sufyan, for giving me the place. Good evening, everyone. Let me try to share my slides. Can everyone see the slide?
Yes, we can see it. We can see it, Sadman.
Okay, thank you so much. So my name is Dr. Sadman Rahman. I'm one of the IMT2 trainees in Medway Hospital in cases Dinari. I'm just going to give some insight about the internal medicine training. Hope it will help everyone who is listening today. So basically, what is internal medicine training? If we start, is the first stage of the specialty training. So in the UK, if we count the medicine training, is usually 6 to 7 years long, and the first 3 years is basically the internal medicine training. Previously, it was called the core medical training, which has been replaced a couple of years back. So during the IMT training, basically, you will work as a SHO or like senior house officer in the first 2 years, and the third year, basically as IMT3, you will be stepping up as a register. And I will tell you, like, once you have completed the IMT3, in the meantime, there is some competencies you need to gain. And of course, during the IMT training, you need to get your full MRCP done before you can apply for the specialty training. So internal medicine training is basically the core medical training, which they have changed the name a couple of years ago. So as I was saying, that IMT training is a 3-year program, and it's basically when you become a medical register, and the whole training is structured in such a way that you will gain all the experience and all the skills which is needed to become a medical registrar. And ultimately, these skills will help you when you become a specialty like trainee, because once you apply for specialty training program, you also need to do in most of the specialty like a gym training, which will help you to act as a medical register. So just focusing on few things during the internal medicine training, there are few compulsory rotation you need to do. So the whole IMT training is being divided in 3 years, as I said, like IMT year 1, IMT year 2, and the third year where you act as a register. So usually the first 2 years you will have rotations of 4 to 6 months. It differs in deaneries and trust. Usually the rotations are usually 4 months. So if it's 4 months during the first 2 years, you will get like 6 rotations. But if in some deanery, if the rotations are 6 months, you will get only 4 rotations. And in IMT3, usually the rotations are of 6 months. So as a reg, you will get like 2 specialty which you want to pursue in the future as a specialty register. You can choose that, like you will have 2 options. So as I was saying, like out of those like rotations in your year 1 and 2, geriatric medicine and intensive, I mean ITU, these are the mandatory rotations. So if you're getting at least 4 rotations, so these will be the 2 of your rotation. Luckily in my deanery, we get rotations of 4 months. So out of the 6 rotation, I have like ITU and geriatric, that's mandatory. And the other 4 rotations, it depends like trainees to trainees. When you apply for your training, you get a place, and according to that, you select wherever like you want to get your training. So every one rotations is different. So basically it's it depends on your merit and also on your luck which rotations you get. So during the whole training, you need to, I'll later discuss that you need to maintain a portfolio. Basically you have to subscribe JRC PTB e-portfolio. That is basically the NHS e-portfolio. And during the whole training program, there's a lot of I would say like evidence you need to gather, and they will be mainly marking you on the 14 SIPs. That's basically like 6 is generic and 8 are like, I would say like most clinical related SIPs that they will mark you how you are doing as a training. So that's what I said, like you will have rotations, usually it's 4 to 6 months in durations, and that's labeled as rotations. So you will have like 4 rotations or like 6 rotations in the first 2 years, and usually the 2 rotations in IMT3. So these are the capabilities in practice. So as I said, these are the 6 generic SIPs. They will basically mark you during the whole training, and these are the 8 clinical SIPs. So basically, if I just quickly just recap, what are the capabilities you need to have when you are working as IMT trainee? You need to work on the acute unselected TED. Basically, you will be clerking patients in ED, which is like acute medicine related. It's not specialty related. You should work also on acute specialty related tech. Some trusts have like some specialty. On our trust, we have geriatric medicine as a specialty tech. Then you need to do ward rounds and basically manage the comorbidities and cognitive impairment. So that's basically the ward job. You manage all the comorbidities of the patient in the ward, see the patient. You need to do clinic as an IMT trainee. So that's the as a non-trainee, when I was working, the basic difference as a trainee, whenever you are rotating in different specialty, you need to do clinics. So currently I'm doing geriatric medicine. So I'm doing clinics in the like elderly care. When I was having like a rotation of respiratory, I was doing respiratory clinic. So you will do clinics wherever you are rotating. Even when I was doing ITU, I was doing clinics in respiratory. So, and the other clinical SIPs is like, you will be a part of the MDT, multidisciplinary team. So when you are working in the ward, you will form a part of the team when they have like family discussions, or there's a very difficult patients, or sometimes in every specialty there's a MDT, like in respiratory there's a lung MDM, or there is some like MDM going about in the gastro, in upper GI or lower GI MDM. So you can join there and learn how to like participate in the EMDM meetings. So, but as a junior, you can always take part in the MDM that's happening in the ward, mostly about a decision trip, like when there's some relatives who have some queries and they're not agreeing with the medical treatment, and there's nurses, other like I would say like palliative team or like physios mostly, and doctors. We are sitting down and having discussion, and you'll be part of the on-call team when you are like doing your on-call. So you will be actively participating in the resuscitation and managing the acutely deteriorating patient. And last of all, as I said, when you are doing geriatric medicine, you will learn about the end of life and the palliative care skills. So apart from the SIPs, the most important thing you need to learn as a like IMT training is the basic medical practical procedures. So these are few of the procedures that you will be assessed, and you need to gain the required skills at the level. So it depends. In the first of a training, probably skills lab, some experience, or if you can do under supervision, that's fine. But once you like move on to your like training pathway from IMT1 to as IMT2, you need to have more advanced skills, and by the end of the IMT2, you need to have like you can do the most of the procedures. You are competent enough to do unsupervised, apart from few of them. So let's come like, are you eligible to apply for the IMT training or not? That's most important question. So I have, there's few points you need to consider. One of them is whether foundation competencies you have or not, whether you have enough experience or not, and whether you have UK eligibility, English language skills, and GMC status. These are the 5 points that's been mentioned in the application. So if we just see that we all have like MBBS or equivalent medical qualification that makes us a doctor, we need to have full registration with the GMC at the intended start date. So if we are IMGs coming from different part of the world, we need to at least have our like PLAB 2 completed and have applied for a registration, and we should have like full registration with the permission to practice. If someone is coming after MRCP, they can also get their full registration. And if we haven't done the foundation here, like UK FP1 or FP2 program, the other way we can get the foundation competency is basically the CREST form. So when you are working, and the other thing they mentioned here, that you need to have 12 months of medical experience following GMC registration and completion. But that's not when you are applying for the IMT training. It's basically when you will be starting the IMT training if you get placed. So if you only started working in UK like 3-4 months back, and currently the IMT training like training application is open, you can apply, because if you get a successful interview and you get a place, you will be starting next August. So by that time you will have 1 year of experience. And whoever is having GMC registration, we all have like required English language skills, because we already have given OAT or IELTS, so that shouldn't be a factor. And evidence of employment history is basically like the place you are working prior to joining the IMT program. They will just ask for some reference. So this is the CREST form. As I said, like you need to have, if you haven't graduated from UK and you haven't done the foundation here, so we need to have this CREST form like signed off. So it's basically one of any consultant who is on the register can sign it, but they of course need to like observe you working under their I'll say under their supervision. So at least you need to work under them 3 to 4 months. And if you go through the form, is basically they have changed it recently, but it's basically the normal things we do. If you have done some on-calls, you have been part of the resuscitation team, if you have done a QIP, if you have done the ALS, and the other things, like if you have managed some patient in the wards, you have done ward rounds under supervision, and if they have seen you that you are competent enough, they can sign off you the CREST forms. But it's basically like working in the UK. And I think like if you are still working back home and someone has the required competency to sign off your CREST form, they can also do it. So you don't need to work in the UK. You can get it signed off back from your country from a consultant who has the required, I would say like degrees to sign it off for you. So this is basically the CREST form. If you search it, you can find it. So it's clearly written what are the criteria for it. So if you just go through it, I think you would be able to understand that. But that's one of the requirements you need to have when you apply for your IMT training. So if I just quickly give a recap, as I was saying, that in this country, when someone goes to medical school, they go and they pass their medical school, they become fully, like I would say, like the MBBS doctor. After that, they do foundation year of 2 years. Basically, in our country, in my home country, it was 1 year, but here the foundation training is 2 years. Once they have completed or they're in the foundation year 2, they can basically apply for the internal medicine training if they are very eager. And as I said, it's 3 years training for most of the specialty you need to do if you are going to do group 1 specialties for higher specialty training. And the higher specialty training for group 1 is usually for 4 years, and then you become CCT completed, like fully consultant. But it's slightly different for group 2 specialty. You can do 2 years of like IMT training. So you don't do the 3rd year as a medical register. You just do 2 years of your IMT. You leave that in, you can apply for the specialty training, which is 4 years, and you then become the consultant of those specialties. The only difference, I would say, like, is you are not doing the 3rd year of the IMT for group 2 specialty. But the main thing, even if you want to apply for the group 2 specialty, you need to complete your full MRCP within these 2 years, which is also a part of requirement for IMT if you're doing group 1 specialty. So that's the only thing. You will have less time to complete your exam, but if you are complete and you are keen to do group 2 specialty, you can skip 1 year of the IMT 3, basically. So these are the few of the group 1 specialties. I would say, like, if anyone is keen for group 2, they might skip the 3rd year of the IMT 3. So there's few specialties. These are the special for group 2. So coming back to the timeline, as I was saying, like IMT training, there is only one window for IMT training application. Usually GP has like 2 application in a year, but for IMT is mostly 1 application during the year. For this year, I have just like shown the timeline just to give you an idea. If someone is planning to apply probably next year or even planning to apply this year, you can see the round 1. There basically is only 1 round, but they have sent it round 1. See, it has opened on the 23rd of October. The application opens, and the application is usually open on the Oriel. There's a website called Oriel. You can see there is the application for IMT training. So you basically need to apply there. So application open on 24th of October, and it will close on 21st of November. So you roughly get 1 month of time to apply. So when you are applying for the IMT training, the only thing you need to apply, submit, is a CREST form. Okay, I'll show you what are the other things you need to show on the application and what basis they will mark you. So there's quite a long process. So first of all, you submit your CREST form, and there is some marking criteria. It's basically portfolio based. You need to write up and self-score how much score you have. So depending on that, they will do a long listing. So that's by 17th of December. I'll tell you what are the points they will long list you. And once they have long listed, they will send the interview invitation to those candidates who have basically long listed. And you have to book the interview on the Oriel. So it will be held over a month, or this time is from 23rd of December to, you have to book it, and then the interview happens from 13th of January to 14th of February. So there's a 1 month. There will be slots for the interview. They will interview you and they will mark you on that. And then there will be a ranking based on the score, how well you have performed on that interview session. And after the rankings has been released, there is a program preference, which dinner you want to join, and what are the rotations, because in Medway, on my year, there were 5 posts for IMT training. So each one has different kind of rotations. So the one you want, probably if you are ranking higher, you will be able to get it. So it all depends on your rank, which area you want to get, and what are the rotations you want to get. So it all depends on your rank. If your rank is better, you can get your choices more easily. And then once you have filled out your program preferences, they will be allocating the offers based on the scores and ranking. So your offer should be out by March. Then there is a timeline for a whole deadline. You want to accept that offer or not. But by the 3rd of April, you need to make a decision, and there will be few upgrades. In the meantime, if someone is like wants to change the mind from one deny to another, and ultimately on the 8th of April, you will get your like final destination while you are starting your training in August. So as I said, like the application opens in probably end of October, but you start the post in August. It's basically the first Wednesday of August, you start your post. So there is basically a long time. So even if you don't have experience of 1 year, if you apply, but if you will be making 1 year by the time you start the training post, that's absolutely fine. So coming back to the application, that's most important. I will just discuss quickly as I have few minutes left. So they have made some changes this year to the IMT application scoring system. So when you are applying on the ORIEL system, as I said, you only need full GMC registration, you need a CREST form, and you need to self-score on these points. So these are the points like postgraduate degree, publication, teaching experience, training in teaching, and quality improvement. And on the publication, there's 2 parts. One is like for poster and some oral presentation, and the other part is like whether you have like some true publication or not. So this year, the marking is on 30. Previously, when I applied and last year, it was 40. So they have made some changes. They have omitted few of the points. So I'm discussing these points because if you focus on like your portfolio on these points so that you can score high, then there's more chance that you'll be longlisted. And once you get longlisted, it's basically you have to face the interview. I'll discuss what they ask like generically in the interview also. So as I said, for postgraduate degree and qualification, so it has like highest 4 points. So someone who has PhD or MD, they can get 4 points easily. If you have a master's level degree, including non-medical qualification, that's 3 points. And if you have like a postgraduate diploma or certificate, you can get 1 point. But you cannot claim point for MRCP. Even if you have full MRCP, you cannot claim any point. So it's quite difficult for newly graduate. I would say like if you are newly graduate, you haven't done any masters or you don't have anything, it's very difficult. But if someone has done like a postgraduate diploma or certificate or have done a master's, then that's fine. You gain like 3 points. That's really like great for you. And when I'm just saying about the points, let me just tell you one thing. You have to make sure whatever you are claiming, you have the evidence at the moment you are submitting your like application. You can't claim any points for something you might achieve in the next few days or the next few months, because you might assume that my training is starting in August. I will be completing my master's in 2 months' time. You cannot claim that. You have to have like completed evidence on the day of the application. So be very careful about that, because it's clearly mentions on the website when you will be applying, you cannot overclaim any points. And if they find you that you are overclaiming, because they can always ask for evidence, and if you are unable to provide any evidence, that's a matter of probity and they can refer you to the GMC. So I would say like be very sure what you are claiming, and if you are not sure, there is an email address, you can always email them that I have these whether I can claim like 3 points for that or 4 points. They are more than happy to help you out what you can claim basically. So coming back to the presentation, as I said, like these has 6 points on the presentation. So if you have an oral presentation at a national level or international level, you can gain 6 points. They have mentioned if you have done like a oral presentation, maybe in the UK, they count it as a nation. So you can get 6 points. If you have done a poster presentation at a national level or international, that's 4. So that's for oral presentation, that's just for poster presentation. 3 points is just for oral presentation at a regional medical meeting. So if you have done maybe a oral presentation in your medical school, so that's a region, right? So you can get 3 points if you have done an oral presentation. But if you have done a poster presentation or a poster at your local hospital, you can get 2 points, or even for oral presentation at a local medical school, not in a region. But if there is like representative from that region, you can get 3 points. Coming back to publication, as I said, like there is 8 points on that. So it basically comes under publication. So if you have a first or joint author of one or more PubMed cited original research, you can get 8 points. But if you are co-author of original research, you can get 6 points. This is very difficult for a new graduate, but I would say like if you have some case report, or if you have done maybe not a original research but other researches, you can get maybe 3 points or like 5 points easily. So if you have an author of one or more chapter of a book related to medicine, that's 5 points. I would say like if you are first or co-author of one of the PubMed cited publication, just like editorials, reviews, case reports, and letters. So I would say like you can aim for 3 points. If you have more than that, that's absolutely fine. But if you at least can get 3 points, that's better. If you have published one or more abstracts or articles that are not PubMed cited, but you have submitted some abstracts to any of the society national conferences and they have like published it, you can get 1 point. So I would say like don't be disheartened seeing that it's quite difficult for the newcomers, but I would say like out of 30 last year, as I can say, out of 40 the cutoff was like 14, I think. So if someone had like on self-scoring 14 or more, they got shortlisted for interview. So you don't need to have like 30 after 30. Try to get as much as you can, basically. Then coming to the teaching experience. So there is some points here and you can basically gain some points easily here. So 5 points is basically if you have worked with a local tutor and you have organized a teaching program. So not about teaching, is basically you have organized a teaching program for the healthcare professional, which is more than 3 months. Okay, so 3 months or longer, you have program and you have also maybe have participated on few of the classes on there, but you need to organize that. That's very much mandatory for that. 3 points is just for providing regular teaching for the healthcare professional. It can be medical student, it can be nurse, it can be anyone for 3 months or longer. And 1 month is just having some like occasional teaching. You might have done like a weekly teaching in one of your specialty or like in one of your rotations, so you can get 1. I would say like just try to organize a teaching program. So in this point, the 5 points, they don't ask you basically to make a new like teaching scheme or something. If someone is working as a like a I would say non-trainee SHO, you can go to your medical education center. Every year there are medical students coming from different universities, so they have some pro forma because they know that some students are coming every year. So you can just ask them how many students are coming and I want to organize maybe some teaching for them. If you are in medicines, you want to cover some acute presentations of the respiratory or whatever specialty, or you can just do like general medicine and you can just work up like I will provide teaching for those students like every 2 days in a week for the next 3 months, and then you can get some like of your friends or like junior F2s and they can also participate. So you will get 5 points because you are organizing that, and if they participate and if they provide teaching for those students, they will get 3 because you are organizing. So that's like more points for you. So try to organize if you can, at least participate in a teaching that lasts more than 3 months. And then you have the training in teaching. So if you have like higher teaching qualification in teaching, like postgraduate diploma or certificate, that's in like medical education teaching, then you get 3 points. I would say like everyone in UK working, you can do the Teach the Teacher course that basically organized by the Oxford Medical School, and you can get 1 point easily for that if you don't have any PG diploma or certificate. Next, coming to the point is QIP and audit. I would say like this is very easy to gain and you should gain like 4 points in that. So they have mentioned that you can get 4 points if you are involved in all aspects of a QIP for 2 cycles or more. So basically you can only get involved in all stages of a QIP if you are the project lead. So you need to lead a project basically for 2 cycles, and following the cycle, there would be some PDSA. You know, when you are doing QIP, there is plan, do, study, and act. So if you do it for 2 cycles and you are involved, because if you are a team leader, so you'll be involved in all the aspects like planning a project, getting a supervisor for that, data collection, then you do the analysis, you make the presentation, you present it, you find out what's there to improve, you plan, and then you act, you do some teaching, maybe poster presentation. If there's something to change in your hospital environment, you do that. Then you do re-audit, you do the same thing, and then you again find out what's happening and you act on that. So if you do that for 2 cycles or more and involved in all the stages, then you can claim 4 points. Otherwise, if you're involved in some stages of 2 cycle of a QIP, you are not like a project lead. You basically are involved in like maybe most of you collected data, you helped in the analysis, you presented in one cycle, in the another cycle, you did some data collection, you did analysis, you can gain 3 points. And there's other way you can get 3 points, involvement in all stages of a single cycle QIP. So that's basically if you're a team leader, but you have done only 1 cycle of a QIP, you haven't been able to do the second cycle, that's fine. If you're involved in all stages of a single cycle QIP, you can also gain 3 points. So I would say like try to get 4. If not, at least 3 is mandatory. You should get it. Otherwise, you cannot like get more points, which would be necessary for long listing. And 1 is involvement in some stages of a single cycle QIP. That's 1 point. And so let's come, like, as I said, those are the points you need to self-score. So when you self-score, they take some time. They say how many people have applied this year. They find out what's the cutoff point of that year, and they make a long list. So once you get long listed, they will ask you for interview. So the interview is held, it's not a face-to-face interview. When I applied for IMT training 2 years back, it was like via Teams, and it's happening via Teams since then. So you basically are being interviewed by 2 of the consultants. So it would be like 20 to 25 minutes, and is via Teams. So if you're applying for job, it's basically quite similar to any job interview, but there's a structure to that. So I'll just focus on that. First of all, they will ask you about your application and achievement. So this part, they will ask you some questions on that. So when you have applied, like I have a QIP of 2 stages and I'm being involved in all the stages of that. So you just can't claim for 4. You have to write down some information about that. When you apply, they will ask you what was the title of the QIP, and what did you do, how did you participate in all the stages. So when you apply, you need to write like in 50 words. There's a like a word limit, and what was the outcome of the project, and how did it impact you, and what was, so you need to write. So when they go through application, so during the interview, they will ask you, okay, can you tell that why you are suitable for IMT? You need to tell them why you think that you are a suitable candidate for IMT. So you need to focus on the like special points you have that make you differentiate from the other candidates, that why you are a good candidate. So you need to focus on your CV and tell them that these are the points I have why you think you are a suitable candidate. So if you have given like part 1 or part 2 of MRCP, that's a good point, because during the training you need to complete the MRCP. So if you have got just part 1, then it shows commitment to that you basically want to do internal medicine training, because you are already focusing on the exam. If you have done a QIP of 2 cycle, because once you are doing IMT training, during the whole IMT, you need to do a 2 cycle QIP. So if you have done a QIP before the training and you know how it's done and you have led a project, so as a trainee, when it's part of your mandatory training requirement, you can obviously do that. So they take these points as like good highlighting points. And I would say like focus on your like foundation year. If you have done non-training jobs, what was the job? What rotations you had? What did you learn? As I focus that during the training, you need to focus on the practical skills also. If you already know how to do ascitic drain, chest drain, if you know how to do lumbar puncture. So if you tell them that I know the most important, even if you can do unsupervised, if you can tell them that, yeah, I have done those skills and I am more than competent to do them supervised by a senior registrar, or That makes like your portfolio more, I would say, like brighter than others. Second is, as I said, suitability for IMT. So they can ask you some question about IMT. So usually they ask you, do you know what's IMT training? So you basically need to have a good knowledge about IMT. You need to tell them this is 3-year training. They have some rotations. What are the mandatory rotations? So if you have worked in geriatric medicine or like ITU, that's a plus point for you, because these are the mandatory training. So if you have some experience, it's good, because when you will be working as IMT, then you have some previous experience which can help you to run the show more easily. And they will ask you like, do you know what is expected as a IMT training? So you need to go through the clinical shapes, practical procedures. You need to understand that you need to pass the MRCP within the year 2, and you need to let them know that what is expected by the year 3. They might ask you, do you know what is year 3? So you act as a medical register, junior medical register. So you will basically lead the I would say like resuscitation call. You'll be the on call overnight. You are the point of contact if you need help. So they basically want to know how much you know about the whole curriculum. They might also ask you like, do you have any specialty in your mind you want to apply? You can tell them that currently I'm doing IMT training, which will include some of the rotations I prefer, but I don't know which specialty I want to go. I will enjoy the rotations and see which one I want to do. And basically, the good thing about IMT is like on the year 3, as I said, that you can choose 2 of your specialty. You might not get 2 of them, but most of the trust or the deanery will try to give you those 2 rotations you want to do for IMT3, because once you have done your year 1 and 2, you have done few rotations. It can be 4 or 6, and you know which specialty you like. So you might like respiratory and cardio. So you can ask, I want to do those rotations as IMT3, because you step up as a register, you work as a register on those 2 rotations in IMT3, and then you make your mind, oh, I need to do that for 4 more years and then become a consultant. So you get the experience as a senior in the IMT3 on those specialties you like to do in your future. So that's a very good, like I would say, like thing during the IMT training. And then they will give you a clinical scenario that basically involve any clinical scenario. Mostly they give you some acutely unwell sick patient. They will give you a scenario. Someone is coming to A&E with these symptoms, and how you are on a take at night, you are on one of the SHO, what would you do? So they will basically assess your clinical knowledge, how you do, and most of the scenario you need to approach by ABCD approach. You do what you find, you do some investigation, and once you're telling them, they will give you some findings. If it's clinically, or like they will give you some blood results, gas results. If you ask for ECG, X-ray, they will give it to you on your screen. So you need to interpret and then move ahead. So it's basically a dynamic scenario. So you just don't keep telling them that you will do this, this, this. Whenever you tell that I will do a VBG, they will say, okay, this is your VBG, what will do? So you move ahead, the scenario is quite dynamic, and at the end of the scenario, they might also ask you some question like, if the patient had this, what would you have done? And always they want you how confident you are. So you are like you will be working as IMT 1 and 2. Of course, you will have a register, and over the night or during the day you have a consultant. But they want to see when you are seeking for support. Of course, so when you need to seek support, you basically need to seek support. That's what they want to see. But if you don't, if it's something like you can manage by yourself, or you are expected to manage by yourself, I wouldn't say always refer to the seniors. So you have to think out which section you need to refer to the senior and which section you need to manage confidently. And at the end of that clinical scenario, they will ask you to hand over that patient to someone. They will ask you, okay, now you are basically ending your shift, you're going home, so you have managed this critically ill patient. Can you hand over this patient to your like a junior? So we all know that for handing over a patient, we use the ASBR method. So you can use that method and just hand over the patient. So you are marked on the handover separately, and you are marked on the clinical scenario separately. And for the suitability of IMT, they will also mark you separately. And on the application and achievement, they will mark you. And at the end, they will ask you an ethical scenario. It's basically if anyone has given PLAB2, all the ethical station we have done, it's quite similar. They will give you an ethical scenario, you are one of the, I would say like SHO in one of the hospital. You are walking through the corridor. You heard that two of your F1s were speaking about a patient, and you went to the ward, and the nurses said like one of the patient wants to speak. You saw that two F1s just near that ward, and the patient is complaining that he or she has listened that the doctors were speaking about him in the corridor. What will you do? So it's basically an ethical scenario. You need to do the station as you do for PLAB to gain some information. Don't assume something. Like you can ask for information that I will ask that F1 in a quiet place. I will tell him what happened exactly. I will gain some information in a non-blaming way. You just do the scenario how you do. So you will be given like 4 or 5 minutes. So once you gain some information, they will give you information. So don't assume anything. There's two consultants, and the other thing, they are both marking you. So they will both mark you, and then you will get a commuted result for that. So always like be open, try to gain information. Sorry. And they will give you more and more information if you're on the correct way. Even if you're going the wrong way, they will ask you some questions at the end, or they will ask you, what are you trying to find out on this scenario? So these are basically the marking criteria for interview, and it's usually like 25 minutes, as I said, and it will be via Teams. So you'll be informed about your interview long way ahead. So as I said, like both of the consultant will mark you on these.
Sorry to interrupt. 2 more minutes, please, just for maintaining the time.
Yes, I'll finish in 2 minutes. So as I said, like they will mark you from 1 to 5. 1 is for very poor and 5 for excellent. So it will be in combination of both of the consultant, how much you score on the interview, and depending on that, basically you will get your ranking released and outcome. But at the end of the results, when they're released, you will also get a feedback from them in written feedback on which station you have done well, and if you haven't done well, what was the thing you could have improved and what went wrong, basically. So that feedback is also very much quite beneficial for you. And as I said, like during the IMT training, you need to maintain a portfolio. If you just search NSH portfolio, you can see that, but you have to buy it for the 3 years. Even trainees have to buy it by themselves. So on that portfolio, there is different sections you have to maintain. Sorry, I'm not going through that today. And thank you so much, everyone, for listening to me.
Thank you, Salman, for perfectly summarizing the IMT, not only the IMT application process, but also what we expect from the IMT trainees once they get selected. While we will give a couple of minutes to see if there is any questions about Salman's presentation. If you have any questions, please write those questions to the chat box. While we wait for that, Salman, if I ask you, do you suggest anything for interview like preparation, any resources or anything that you suggest for people to, because we know that the IMT application is open now, so the interview will come very quickly. Anything that you suggest for
so I would say like if you have done ALS, that covers most of the acute things you need to basically know for the interview, for the clinical scenario. But otherwise, I think there's an app, I forgot the name. It has a basic summary of all the IMT questions and the scenarios. So they basically ask you all the common scenarios like acute exacerbation of asthma, or like they can ask you management plan of upper GI bleed, but they give a scenario. So always approach by A, B, C, D, E. Try to manage the acute scenario. And always, like whenever you're doing one, because if someone has done ALS, you need to do A, then go to B. Don't jump. So if you go step by step and do the investigations, if you ask for that, I will do a chest X-ray. They might give you a finding. Okay, chest X-ray is normal. They will say something to you. If they don't say, assume it's normal. If you say, I'll do a ECG, then they will give you a ECG. If there is something, then you need to act on that. So I would say, like, if you have done ALS, that's very good. I would say like that prepares you well for the acute scenarios. Other than that, go through your portfolio, because it starts with your portfolio and IMT training. These are the first two questions they ask you. So once you make a good impression in the interview, I think your interview will run good. So once you have given good impression about your portfolio, only focus on those things which you can highlight. Don't tell things that I had a gap in clinical experience of 6 months. They're not asking you. They're asking you why you think you are like a good candidate. So focus on your good points. Say that you have done this, whatever you have done, and you are so passionate about the IMT training, and let them know that you know the whole curriculum of the IMT, because they will ask you why you think. If you let them know that you know the whole ins and out, they basically find interest. Or this candidate knows everything about this training program, so he must be very interested in that. And the other thing I would say, like, try to prepare yourself for interview. Most of the people, I think, like, they have the knowledge, but during the interview they are like so afraid or like anxious. So you need to break that anxiety during the interview, because it's 20 minutes, and however you perform, they mark on you on that interview. You might have a lot of knowledge, but if you cannot perform on that day, it's your bad luck.
So, Sadman, there is a question. So
Yeah.
the question is, if someone has arranged teaching at home country for 6 months but no formal evidence, can they still claim 5 points?
No, so basically you need to have formal evidence. So they have written it down. There's a form also. If you go to the website, IMT teaching, if you search it, there's a teaching observation or like teaching feedback form. You can download it. It's a paper-based form, but you need to have formal feedback. That's clearly mentioned. You need to have formal feedback for your teaching. And if you have organized that, probably you have to have another certificate that you have organized the teaching for 3 months or longer. You don't need to have 6 months, but you need to have formal feedbacks for any teaching. It's not about just teaching. You need to have formal feedback. Even if you're claiming 1 point, if you don't have any formal feedback, they don't basically count it. It's clearly written. You need to have formal feedback from them.
Yeah, I think the feedback is I think they
Yeah.
prioritize mostly the feedbacks.
Yeah. Yes.
Without the feedback, it would be quite challenging to claim those points. For organizations, if you can get a letter from from the consultant or probably the your head of department, that might help, but they would still want some formal feedback. So you will have to find the formal feedbacks to apply for those to get those points. Sadman, just for the time constraint,
Yeah.
oh, there is a question. Can you please clarify how to have formal feedback?
So if you search on the IMT, if you search like IMT or like if you search in the Google teaching feedback form, there's quite a lot of form. You don't need to have that specific form. If you have like organized the teaching, and if you just like make your own teaching feedback form, that's fine. Like if you just like, how was the quality of the teaching? How was the content of the teaching? So if you make a form or a Google spreadsheet, I would say let's just get the feedback from the students, or who, if it was nurses, just get the feedback in. That's most important. So you can create them, but there is like a generic teaching feedback form on the website of the GRCPTB. Yeah.
I'll try to share in the chat box a kind of like a standard feedback form. So if anyone is interested, you can look at it. I'll just share it in the chat box in next couple of minutes. Just for the time constraint, I think we will stop our first part here. Thank you, Sadman, again for your presentation.
Hi.
And I think
Thank you,
Sadman,
Dr. Sofyan.
if you don't mind just sharing your email address, if anyone has any questions about
Yeah, of course.
the
Yeah.
IMT application process, if you can send the email to Sadman, I'm sure that he'll be more than happy to help.
Yeah, of course.
So we'll get like 5 minutes break. And after that, I will hand over to Dr. Asif Khan, who is going to convey the next session, which is going to be like sharing the success stories. And then we will go into the specialty application process. So we'll be back around. So shall I say UK standard time around 37 minutes past 8. So in 5 minutes of time. Thank you.
So thank you all for joining in today's session. Thank you so much, Shadman, for conducting such an informative session. And definitely thanks to Sofian for conducting the sessions. So I welcome you all back after the break. First of all, I'd like to share something with all the participants. To get your participant certificates, you need to fill up the feedback form that I'll be sharing towards the end of the next session by Dr. Noor. So before going to the second session of our training, I would like to invite Dr. Mohammad Selim Reza, who recently got a training post, and I would request Selim to uh, tell about where he is working now and what are the offers he got and where he is going to join. Dr. Mohammad Selim Reza, please switch on your camera and mic.
Thank you, Asif Bhai, for giving me this opportunity to share my experiences and the success story. So, in this round two application of ST4, I basically applied for three specialties. One is acute medicine, another is geriatric medicine, and the last one was a stroke and general medicine. So, I got all of the offers. So, two of the offers I got in Oxford. One is acute medicine, and another is geriatric medicine plus a stroke. And the other for geriatric medicine, I got it in Coventry, West Midlands, particularly where I'm living in right now. So finally, I decided to join the stroke medicine and general medicine. The main reason behind choosing this specialty was this is a 3 years only, 3 years training only, and after 3 years, you can be able to practice as a general medicine physician plus a stroke physician as well. So that's basically the main reason I took the opportunity, and also the offer I got from Oxford, so I could not decline it. So that's basically my offers and experience offers. Currently, I'm working as a trust grade registrar in geriatric medicine in Northampton General Hospital, NHS Trust. Um, should I just give some tips regarding how I have got so far, or just this one, Asif Bhai? Do you want me to explain further?
Okay, thank you. No, Selim, please hold on with us. Just one or two quick questions if anybody has for Dr. Selim. Okay, we can see any question. So if anybody likes to say anything to Dr. Selim, any comment, appreciation, anything before we move on to the next speaker. Okay, we got a message from Rahman Azhar. It's inspiring. Fine.
Yeah, thank you very much.
Okay, so before saying you goodbye, Selim, any short message for all the doctors who are going to appear for training application this term? Very
Yeah,
briefly.
definitely. What I'd like to basically say that a lot of IMGs who completes the MRCP Part 2 written or completing MRCP paces coming here want to go for IMTs. For them, my message should be if you have got the opportunity, like if you have already completed MRCP Part 2 written or paces, I would say don't go for the IMT training because it will consume your 3 years. Rather, try to get your alternative competencies signed and try to apply for the ST4, and hopefully, inshallah, you will get it. It's not that competitive what we actually think it is. So if you're already near completing to the paces, just go for the alternative competencies instead of going for IMT. So that's my tips. If anyone try to contact me, I'm happy to answer the questions, or I'm happy to clarify these queries in the next. Thank you.
Selim, would you mind sharing your email address for that purpose for contacting you further, please?
Yes, you can send me an email, selimreza2275 at
Uh,
gmail.com. I'll
would you
write it
please
down.
would
Yeah,
you
yeah, yeah.
please share it in the chat box, please?
Yes, yes, definitely.
And thank you so much, Selim. You came up with a very out of the box tips for the doctors, like approaching ST4 directly. Thank you so much for your time and your tips, everything. So that's where we would not like to leave you, but the time constraint makes us to say you goodbye. Thanks for
Okay.
joining and keep being with us.
All right. Yeah. Thank you very much.
Thank you. So then we will move to Dr. Mehdi Hassan Mishuk. I would invite Dr. Mehdi Hassan Mishuk to share his story, please.
Hello everyone. Can you listen to me, Asif bhai, and everyone?
Yes, we can. Please go on.
Okay. Hi, good evening, everyone. My name is Mehdi. So, and my nickname is Mishuk. Anyway, so this year basically I got 2 offers. I applied for two applications, but I got 2 offers. One is in acute medicine, and another one is in renal medicine. Both of the offers I got in my #1 choice ranking. My background wise, I came to UK in 2019. Then I worked as a medical SHO in different departments for 3.5 years. Then I became a registrar like early last year. And then I got experience as a registrar for 1.5 years. Then I applied for training this time, and this is my first attempt. So then I tried and I got it. And congratulations to Selim and congratulations to others who have got this and obviously who will be getting this in future. Advance congratulations to everyone. And that's me really. And if you want to share some tips, if you want me to share some tips, I'm more than happy. Or if you have any question that will help me to answer, or what's your main query, I can answer better.
Okay, thank you, Mehdi. Congratulations on behalf of all. So if anybody has any 1 or 2 quick questions for Mehdi, then we will move to the second session of our today's program. Okay, fine. Thank you. I can't see any question for Mehdi. Some
Thanks.
congratulations going on the chat box. And thank you, Mehdi, for joining us today and sharing your email already. So
Yes.
we would definitely request our participants today, since our first speaker, Dr. Sadman, then Dr. Selim Reza, Dr. Mishuk, who got their training numbers recently, already shared their email address. Please keep in touch with them. And with that, I will hand over the session to Dr. Sofian to coordinate the next session, please.
Thank you. Thank you, everyone.
Thank you all. Thank you both for sharing the success stories. I think these success stories always actually help us to kind of like guide us and help us to decide what we want to do. Without going any further, I'll now ask Dr. Amina Noor to present the specialty training pathway and the application process. Over to you, Amina.
Amina, you need to switch on your mic, please.
Yes, it's done. So welcome everyone in today's webinar. Thank you DMC Club UK for creating this opportunity to share our insight and our experience in specialty training and IMT training. My name is Amina Noor. I'm one of the ST5 rheumatology registrar, currently working in KSS Deanery. Thank you everyone who have arranged this program, and especially thank you to Shadman That was quite detailed presentation, and it was quite well explained. And congratulations to Selim and Mishuk for your specialty training, which is coming ahead. I'm not sure if you guys can actually see my slide. Let me see if I can.
We can see. Amina.
We can
Right.
see it, Amina, but could you please just change it to like slide view? In that case, it might be just full screen in that case.
I'm trying to do that. Let me do something. Let me just stop sharing and start sharing it again. Probably it will be easier for me then. Okay. So is it full screen now?
Yes.
Okay, that's great. I think Shadman has already explained a lot of things, so probably I'm not going to tell very detailed about that. I think Shadman already explained how the training post works. The title of my presentation is ST4 training application. Probably it can be both ST3 and ST4 training application, because in UK, some of the training posts, they start from ST3, which are the group 2 specialties, and usually the group 1 specialties, they start after the MT3 as a ST4. So the topics that we are going to discuss today is the timeline, the eligibility criteria, how to do the application, interviews and offers. And all this information has been taken from the specialty recruitment website, and you can actually access everything in detail. So I will probably try to be a bit precise, and we'll try to keep more time for question and answer. In UK, usually there is a round 1 and round 2 application. The round 1 application process usually starts from November, when the application starts, and the post starts on August of the next year. So this year, the application is going to start on 14th November, and the application process will be closing on 5th of December. So before 5th of December, you need to complete the whole application process. The interviews usually held between January to April of next year. And the first of our deadlines are on 15th April 2025. The round 2 application will open on July next year, and the application will close on August 14, 2025. This program will start from in between February to April, but that will be in 2026. So in UK, we have 2 specialty group, the group 1 and group 2. I will tell about group 2 specialties first. So the difference between these 2 specialty, those who are group 2 specialties, these are core specialty. So that means once you finish the specialty, you will be accredited only that specialty. For example, some of the very popular group 2 specialties are dermatology, hematology, clinical oncology, medical oncology. So if I tell in a very easy way, so if you are doing group 2 specialties, you do not need to do the GIM or general internal medicine. That means you do not need to do the medical register post. And group 1 specialty is basically all the rest of the medical specialty. They are now dual accredited. That means you have to fulfill the curriculum of your own specialty, and also have to fulfill the curriculum of the GIM specialty. And you need to do the GIM on-call, acute take and everything. Basically have to do the medical register like responsibilities. So there are 6 eligibility criteria. I'm going to talk very briefly about that. First of all is MSCP UK exam. So before starting the specialty training, you need to complete the MSCP UK exam. That means you need to finish all parts of the exam before the deadline. So just want to make it a bit clear. For example, someone wants to apply this year for the next year in round 1. Suppose you have completed your MSCP part 1 and part 2, you haven't given your PACES yet, or maybe not successful, but you are looking forward to give the PACES exam. So in that case, you will be able to apply for the specialty training. You'll be able to participate in the interview of the specialty training. But you need to make sure before the first offer comes on 15th of April, you need to complete the whole MRCP degree. Really sorry.
You are mute, Amina.
Can you hear me now? Can everyone hear me now?
Yes, yeah.
Yeah, so before the first offer on 15th of April, you need to complete the MSCP, the whole thing, including the PACES. The next is, for some reason, my slide just froze. Yeah, so the next thing is the competencies. These competencies can be achieved in 2 ways. One is completion of the IMT training. I think Shadman already explained about these things, so I'm not going to talk about this. And the second is the alternative competencies. So there is a few things that you need to fulfill to show that you are competent enough as someone who has completed the IMT training. So the form is in the, the recruitment website. So I think I do not need to tell very detailed thing about the competency certificate. I just want to give a bit reminder on a few things. First of all, the consultant are only eligible to sign off your competencies if they have worked with you for 3 consecutive months in last 3.5 years before you start your post. And also this consultant needs to work for at least 5 years before they signed off your competency. And also they need to have an accurate knowledge of the IMT curriculum. I think alternative competency has changed a bit in last couple of years. They have added some extra point, for example, seeing 500 patients in the acute unselected take, doing 4 multiple consultant feedback, doing 12 multi-source feedback, completion of the QIP, and a geriatric and critical care medicine experience. I think these all have been explained quite nicely in the form in the GSCPTB recruitment website. And I probably, for like saving time, I'm not going to talk very detailed about this. But I think some of our colleagues has already explained their wishes that if someone needs any help with the alternative competencies, they are quite happy to help, and thank you for that. So about the experience, you need at least 36 months experience. And this 36-month experience is after your F1 experience. For example, if someone who is an overseas doctor like me, this experience will be counted after you finish your internship. So after internship, you need to have 36 months experience. There is no residential labor market bar nowadays. So this was like a rule that was, I think, few years back. Luckily, we have been spared from there. About the English language skills, I think if you are working in the NHS and if you already have a valid GMC registration, you do not need to show any sort of skills or any sort of certificate to show that you are good enough as a doctor to use English as your written and spoken medium of the language. I think you are working in the NHS and you have a GMC registration. That is enough. You do not need to show anything else like IELTS or anything like that. Definitely, you will need to have a GMC registration or licensing before the advertised post starts. And next is planning your application. So the whole application process goes through the ORIEL, which is like a very good and detailed thing. So I'm going to talk a bit about sorry, just a second. I think there are a few things that in my computer system is not working. Is it all right if you can give me 1 minute of time and I rejoin? Sorry, guys, just give me 1 minute of time. Sorry about that. I'm very sorry about that. Can you all hear me and see me?
Yes, we can hear you and see your screen.
Yeah, thank you so much. I actually made some last minute changes and this slide just like how it was done, just had to change that schedule. So I was talking about the planning and making the application. So I think, first of all, very important is to decide which specialties you wish to apply for. And I know in most of the cases, we usually have more than one specialties of choice. In that case, I think it's a very good idea to look at the competition ratios for the previous recruitment, and also to have a look on the demographic status, like which area of the deanery was fulfilled and everything. I think this sort of information makes you help you to make your decision, and probably to decide which specialty probably would be easier for you or will be more tougher. You can apply to as many specialties as you like, subject to the eligibility. And also, I think a very important thing is to review your person specification, because that's what they will actually judge during the interview. I think in every specialty, if you go to the website, they mention of the person specification and what actually they want from that specific specialty register. For example, if you are applying for care of the elderly, there is some person specification written, and they want to know, are you that person who they want to be care of elderly specialist? And also read all the supporting information before commencing your application. So the next thing which is important is paying particular attention to demonstrate that the requirement of the parcel specification has been mentioned. So when you will apply in the ORIAL and you will start your application, at the end, there is a topic called commitment to the specialty. Basically, on that box, you need to write why you want to do that specific specialty, and what have you done to showcase that you are quite committed to the specialty. So when I applied, what I did actually try to find out that what are the requirements they are expecting from the registrar, and try to rephrase the word and try to use those words on your commitment to the specialty, so that when they read, they can get a good idea that you are the right person. Also very important, make sure that you have plenty of the time before you submit the application. Two reasons for that. Although ORIAL is a very good system, I think one of the flaw of the ORIAL is they do not auto-update. For example, suppose you are applying for 3 specialty like acute medicine, care of elderly medicine, endocrinology. So in ORIAL, there is very detailed question about whole of your occupational history sort of thing. For example, since you have graduated, where have you worked, from what date to what date, and what was your role on that particular position. So you need to write all this thing and mention the dates. Suppose you have submitted everything for acute medicine. When you will start doing the application for the next specialty, all this information doesn't auto-update. So what basically you need to do, you need to write everything again, which is very, very time consuming. And to be honest, I think for completing one application, you definitely need good dedicated few hours in 2 consecutive days. Also, another thing is, please do not keep this application submit for the last moment, because sometimes the computer system might crash, there can be some problem. So try to make sure that you are allowing plenty of time. On the application, there is a self-assessment. So you need to self-score yourself. When you are self-scoring yourself, please make sure that you have enough evidence to support the score that you are asking for. I think Shadman already explained that the score can be underscored a bit or can be overscored a bit, but please make sure so that you do not overscore yourself too much, because obviously they can always ask for the evidence, and if it's seen that you have actually asked a lot more that you are supposed to show, then this is a probity issue. And please ensure that you have submitted everything that needs to be submitted at the time of the application. And please double check your application before submission. This is particularly important because once you submitted the application, there is no way to turn back. So this cannot be changed. So if there is any sort of mistake, that can be corrected by the applicants and also not by the recruitment office. So please make sure that you double checked everything. Once you have submitted your application, all the information will come through the ORIEL. Also, you will get individual email for any sort of information. For example, if the interview opens, if there is any change in the recruitment process, they will update you everything through the email. But sometimes the email lags a bit, so this comes a bit delayed compared to the ORIEL. So I will probably advise to keep an eye on the ORIEL so that you can get up-to-date information very quickly. I'm going to talk a bit more about the self-assessment verification. As I mentioned, that you need to show the evidence for everything you are scoring for. And for uploading all this evidence, you will be sent a self-assessment portal, and you will be sent the login details where you need to upload all this information. Please check the deadline. After the deadline, the assessors will be given access to review and score the evidence. So now keep in mind that this scores can be increased, decreased, or can become the same. And once they have completed the review, they will let you know what is your verified score. You will have the opportunity to appeal. For example, if you feel that the score that they have given to you, you are not quite happy, and you feel that you should have scored more, you can appeal for that on the estimated time. But something that you cannot do, that you cannot upload any more of additional evidence. So that is the reason that make sure when you are submitting, you have submitted all the evidence you have because you can't upload anything later. Although the scoring for commitment to the specialty comes at the end, I am telling it at the beginning because I think it is very important. So this commitment to the specialty, I will say it's a bit, I don't know how to say it, because if you look at the commitment to the specialty score, there is a score of 0, there is a score of 10, and then there is a score of 2. So there is a big gap between 2 and 10. So basically, you need to show them that what have you done to show that you want to do that specialty. So now, don't worry about that. If you are scoring quite less for commitment to the specialty, there will be 2 boards, and they will each score you for this point. I haven't actually seen anyone who has scored 20 to this scoring point. Most of us has actually got 4. Some of my friends I have even seen to get 0, but they qualified in the interview. So even if you are getting like 4, do not be disheartened, or even 0, do not be disheartened. I think the ultimate result actually depends on how you have performed in your interview. So about these points for the application process, I do not think I need to go very detailed about that, but what I will tell, read this very carefully. And if you are not sure about what they exactly ask for, like Salman mentioned, you can always email them, and they are quite prompt. So what no one wants that not to understand what they exactly ask for, and then underscored themselves and actually get less points. So if you are not sure about anything, please contact with them. Same thing goes for the MRCP UK. So if you have completed all 3 parts, you will be scored 8. If you have completed MRCP Part 1 and completed PACES, but you haven't done the MRCP Part 2, then it's 6. if you have passed MRCP Part 2 and of course MRCP Part 1, then you will be scored 2. And if you haven't done any part, obviously 0. I don't think that even comes because you can't apply then. So about the presentation, I think I will not go very detailed about that, but please give it a read. The national and international medical meeting, sometimes it is quite difficult to get, but I think it's quite easy to get an oral presentation in the regional medical meeting and also in the local medical meeting. So the local medical meeting, you can actually present in your grand round in your hospital, and it can work like that. I don't think getting a regional medical meeting is very tough. For example, if in UK, if you work in a multi-site trust, that means your trust covers a few hospitals. So if you do a teaching and all the doctors, all the hospitals can access that, that can be also counted as a regional medical meeting. About the publication, I think Shadman already explained that, so I will probably not go detailed on that. The teaching experience, it's very well explained. I think just to answer Rahma's question, that even if you have done some teaching back home, you can bring a certificate from your institute or from your consultant that you have done teaching, but you need to show some sort of feedback to them. The training in the teaching, if you have a PG certificate or the diploma, you are going to get a score of 3, but it also needs to be at least 60 credit point. When we applied for the specialty training, I think we mainly did the teach the teacher or train the trainers, this sort of training in the teaching. For all this, you score 1. For the quality improvement project, I think Shadman already explained how this works. Just make sure that you check the PDSA cycle, because now I think they made it a bit different than how it used to be. That, for example, for scoring the highest point of the 4, you need to demonstrate that you have actually done a leadership role. It probably needs to be mentioned on the certificate that you have done a proper, like a leadership role there, which I do not think is very difficult, because in a quality improvement project, usually there is more than one leader. So if you just can ask your education center to do a certificate in that way, that can be easily achievable. And usually the education center, they are quite helpful because they know this is one of our curriculum need and we need that for our training position. So approach to them. I think they always helps. That is what my experience in last 5 years of working in NHS. About the interview happens virtually. There is no face-to-face interview process since 2020, since COVID. So because this happens virtually, make sure that you have a good access, make sure that you have like an appropriate environment, because you also need to move the camera and show that there is no one in the room, and you do not have any access to any books or anything. So make sure that you find that like space where you can do your interview. Usually on interview dates, all interview station will consist 2 scoring interviewers. In some cases, there might be a third person who generally sits there just to observe that everything is happening smoothly, and sometimes they also sit there so that they can be examined the next time. So they usually do not score you. About the interview panel, I think it varies from specialty to specialty. So every specialty has their own way of arranging for the interview. There is usually 2 panel, but 2 sets of scoring. It will stay in whatever specialty you are applying for. One is tell about yourself and why you want to do that specialty. I think this is how your interview starts, and it is very important because that's when you make an impression on your interviewer. as Shadman mentioned, try to focus on the good thing, the positive things you have done rather than the things that you haven't done, because it's only for 3 to 4 minutes. It's not actually a huge amount of the time. So I'm pretty sure you guys all have worked really hard. And if you can focus on that, this 4 and 5 minutes time is enough. Other thing is, which is common now for all group 1 specialty, is the medical register suitability. This is also very important. In medical register suitability, they basically wants to see how you are as a medical registrar. I think in this specific station, they more than your clinical skills, they're actually assessing how you are as a leadership role. Because obviously, when you are a medical registrar, the most important job is to make sure that your team is working well and you are leading them well. So I think this sort of question they ask, what do you do in a tricky situation? What do you do as a medical registrar when there is the morning handover? What do you do as a medical registrar at the night handover? What you will do as a medical registrar if you find out that on your shift there is less people than you are expecting, and few of them are F1, and basically there's just one senior person other than you. So this sort of question, which I'm pretty sure you deal in your day-to-day on-calls. One thing I will say, is always good to have a format in this sort of question, like to give some background, to give a bit detail on what you should do and why you have taken that judgment. I know that it's not always easy to follow a pattern, but of course, it's an interview situation. You have lots of adrenaline secreting, and on that moment of the pressure, I think if you have a format, then at least to make sure that you are not missing something which is important to tell. Rest of the station, as I mentioned, that varies from specialty to specialty. For example, in endocrinology, there is a diabetes specialty and there is a non-diabetes. But whatever the points are, usually what they try to assess is, do you know about the most common medical emergencies of that specific specialty? So I will really advise you to go through the Oxford Handbook of the Medicine, the back part where the medical emergencies are written quite clearly. And as Shadman mentioned, of course, you need to do A, B, C, D, E, but of course, keep in mind that now you are registered, so definitely our approach will be a bit different. They're expecting more capability and more like senior sort of review when you are saying that what you are going to do in the emergency situation. The time required at the interview can slightly vary. They usually ask us to keep 2 hours of time. I think it's very unusual to take more than that because the real interview is usually 40 minutes. But before that, you have to sit there and they prepare everything. So it just makes sure that you kept good amount of the time so that there is no sort of rush. Few of the specialty, they have presentation. In that cases, you need to prepare for a presentation. But of course, they will let you know this way before. You will get an email and they usually give enough cue to make sure that you have done everything rightly. About the interview scoring, so interview scoring is done by the 2 panel. All of this question will be marked between 1 to 5. So 1 is basically the poor, not considered appointable, and 5 is an excellent score. 2 is area of concern, and 3 is satisfactory. So between 3 to 5, I think it's all right. It's not bad. But you need to make sure that to be classified as appointable, none of your interview score can be 1 by 5, which is the poor score. And no more than 2 of your interview score can be 2 by 5. But I think in interview board, like I have applied for 3 specialties. All of them, interviewer, I actually found quite approachable, quite helpful. And they understand the amount of the pressure we are when we are giving an interview. And I found them extremely helpful. Like they try to calm you down if you are going out of the direction or going to the opposite direction. They always try to calm you down. So I think don't worry about how things go. Just be yourself and make sure that the approach is quite systematic. Next, the training offers, which is the end point of all this application process. So these offers will be made through the ORIAL based on the rank you are getting and the geographical preferences. So if you haven't chosen, so before giving the training offers, they will actually send you an email where they will ask for the preferences of the region where you want to go and what is your first preference, second preference, like this. So if you haven't picked a preferred area, they will not rank you on that area. For example, if you decide that, no, I definitely doesn't want to go to London, and if you haven't given London as one of your preferred place, even if you scored highest among all the applicants who has applied, they will not rank you for that preference. So there are 48 hours to respond, hold, or decline. This is also a bit tricky. This 48 hours to respond, hold, or decline. Sometimes this does not come like this because, you know, obviously you understand the offer might come in different day for different applicants. For example, those people who haven't taken that specialty position, those spaces might be empty and that space can be offered to the next person who is in the line. So if it is quite in the end of the time, you might not get the opportunity to have the hold position. On that case, there is just the respond or the decline. So about holding a position, you can only hold one offer at one time. You can't hold more than one offer at a time. And once you accept a post, even if you have applied for the other specialty, you will not get any other further offer. And if you decline a post, that means that you are not going to get any further offer from that specialty, but you will get the offer from the other specialties. And depending on what is your score and ranking, the offers can be upgraded if you opt in. I will say it's always a good option to keep the offer for upgrade if you are not happy with your position. But for example, if you want to go to KSS and you have got that, please do not keep the upgrade option, because if you opt in that, then if there is any other available position on your above ranked area, you will be like just ported there automatically and you cannot come below as well. So just make sure that you are choosing the right option. So as I mentioned, all this information has been taken from the physician higher specialty training recruitment. And I'm quite happy to take any question if anyone have a question.
Thank you, Amina, for summarizing the ST4 application process and kind of like put it more quite nicely how the process works. If anyone have any questions, please put the questions in the chat box. And while we wait for the questions in the chat box, Amina, can I ask you how, if you can just tell us a bit more that how can we show your commitment to the specialty? What do you suggest to do if someone wants to show commitment to the specialty?
That's a very good question. What I would like to tell, some people might feel, some trainees or some doctors might feel that, for example, I want to do nephrology. I have never worked in nephrology, or if I have worked, might be for a very brief period. Some might find that, okay, I'm an IMT trainee, but I didn't have any nephrology rotation. So how can I show my commitment? Because I haven't worked on that specialty for a long time. So one thing I would like to make very clear, I think any specialty, they do not want a starting register who already know everything about their specialty. So they know they are taking someone who just completed their general internal medicine, just stepped up as a reg, and a very new in this field of training. So don't be worried if you do not have any rotation or you do not have enough experience. Please make sure if you want to do a specialty, you have done as much possible things in your capability from your role. That doesn't mean that you need to travel to another hospital or you need to switch your job. What I mean that you can show them that you were quite interested in, for example, nephrology. You have done an audit on a chronic kidney disease patient who came to your hospital. You have tried to improve the service provision of in your hospital, how the CKD patients have managed, and you tried your best to improve how things works. You can do conferences or attend some training day for that specialties. You can also liaise with the consultant from those specialties. Sometimes like a short tester week, like 1 week tester week also looks good. For example, I applied for rheumatology, but I didn't have any rheumatology rotation in my internal medicine training. So what I have basically done, I have done a QI project. I have done few clinics with my rheumatology consultants. I have also attended one of the conference, which is also virtually. It's not like I bodily attended that conference. And I think that's all. Like I kept in good touch with the rheumatology consultants, like discussed with them quite frequently what better I can do. I think that's what they want, that you are interested. I think that's what they want to see. So try to show them that you are the best candidate from your position.
Absolutely. And I think I can also definitely say a few things also helps, like the society memberships are usually free. So if you know that what you want to do, if you become membership of that society in your core training period, that shows your commitment to that specialty. And there are a few free courses too. So think about doing those free courses, and that might help. There is a question from Dr. Krishna. How to provide evidence for presentation at regional level?
That's a good question. So as I mentioned, there are various ways, but I think the most easy is, suppose if you are on NHS trust, which is multi-trust. For example, under any NHS trust, there are a few hospitals. So if you are doing some sort of teaching on grand round that all this hospital has participated, it can be shown as a regional level teaching. And if you can liaise with the education center in your hospital, they can also give you some ideas about how to achieve that. I think that's the easy way, but
and the evidence could be, you could just show a certificate that you presented there, and you can also show some teaching feedbacks or presentation feedback from your consultant colleagues, and that might also help. So I can't see any further questions. So thank you, Amina, again for presenting the specialty application process in details. I hope you wouldn't mind just to share your email address in the chat box. If someone has any questions, you can come write to Amina, and then she will try to answer these questions. I'm one of the respiratory consultants, so I'm also going to share my email address. If there is any questions or any feedback, please let us know. I'll again thanks everyone who joined this webinar today. I think there is a question that where will the recording of this meeting? So I believe that the recording of the meeting will be shared, and I think the recording can be sent to the email. I'm not sure if Asif Bhai, if you want to just add on something.
Yes, the whole session is being recorded and it will be sent to the participants. And we'll also upload this recorded video in our Facebook page and YouTube channel, that is DMC Club UK. So maybe by tomorrow they will be available for anybody to check back.
Perfect. And as I also was saying that DMC Club UK is going to arrange few more webinars. So next week there is a psychiatric training pathway webinar. So if any of your colleagues or anyone else is interested, please keep an eye on the DMC Club UK page, and you can register for the psychiatric training pathway webinar for next week. Again, thank you everyone. I'll just pass over to Dr. Khan to just Asif Bhai to just finish the webinar. Thank you, everyone.
Hello. Sorry, I have a question.
Yeah, sure.
Actually, I want to ask, like, suppose I haven't done this paper presentation in PubMed Index Journal, and I have done in some other journal. So, but it is proposed like in the future it will be published. So can I like the marking will be low if it is not PubMed Journal Index Journal?
Amina, do you want to answer the question?
Yeah, so what I understand from your question, that you are trying to say that you are in the queue of publishing like a publication in somewhere other than PubMed. Is that correct? That hasn't been published yet, but you are quite sure that that will be published, basically yet to be published.
I have a journal which is already published in not in PubMed, but in other journal. But the other other I have this paper which is about to be getting published in PubMed, but I don't know the date. So for that, like, how will be my marking?
So two things here. First of all, you are waiting for a PubMed journal to publish. I'm not sure if you know about the timeline for that, because if you are publishing submit in a PubMed cited research publication, and if you are the first author or the joint first author or corresponding author, then you can score 8. So now, in the case if you do not know about the timeline when this is going to be published, and if you feel that that's going to probably take like a long more time, then I think the next option is the scoring 3, which is the first author, joint first author, corresponding author in one PubMed cited other publication. So not PubMed, but other publication. To be honest, if I were you, what I would probably do, I will claim for the highest score, but I will explain everything quite clearly that you are waiting for that. And I don't know if you, because I've never published anything in the PubMed, I don't know if they give you any sort of like registration number or something which you can upload as sort of evidence that this is the number of my publication and I'm still waiting it to be published. And you can also mention in the bottom that I have already a published sort of abstract or publication which has been published in this specific journal. And suppose by this time, if your publication has already been published, then that's good. You are going to get like highest score. But for any reason, if they do not accept your evidence of publication, then I think I can't find any reason not to give you the score that you asked for, which is 3 for publishing an abstract in a non-PubMed journal.
It should be published by 14th of this month, right?
Yes, 14th of November, yes.
Okay. Thank
Yeah, so I think you're not claiming something mistakenly, or it's not like a false claim that you are doing. So I think I don't know how this works. If you have sort of like a publication number or something, or they have sent you some sort of email or anything that it is going to be published, you can like upload those evidence and can score for the highest point. But if they do not feel that, okay, it cannot be taken, they can change the score, and what wrong might happen, they will probably give you lesser score. But I do not see any harm in trying if you have enough evidence. You have worked hard for that publication, isn't it?
So I have to upload all the evidences and then they will like mark accordingly, whatever they feel.
Exactly. Yes. Upload everything. They will then judge that on the score. But you have tried your best, isn't it?
Thank you. Thank you.
So thank you, Dr. Amina, for your nice presentation. Thank you, Dr. Sufyan, for your nice coordination and sharing your email address. So for all the participants, it was a long evening for all of us. I already shared the link for upcoming webinar on 8th November. That's the psychiatry training pathway. And I also shared our Facebook page link and YouTube channel link. You can subscribe, like, share the things. And finally, before saying you all goodbye for today, I'm sharing the feedback form link, because you have done a tremendous job attending this session for long 2 hours. But due to technical reason, until you fill up this feedback form, we can provide you with the participation certificates. So with that, I will say goodbye and saying thanks to all our speakers today, Dr. Shadman, Dr. Amina, Dr. Selim Reza, Dr. Mishuk, and definitely Dr. Sufyan. Without him, we couldn't make it happen. And see you on some other webinars. Thank you so much.
Thank you
That's
so
all
much,
for today.
organizer, and thank you all the attendees. I hope you get what you want and wish you all the best.
I have a question. From where this marking is like, from where I can get this PDF, the marking, which is this?
Okay, so I think if you Google the higher specialty recruitment, it will take you to that page and everything written very detailed there. So if you go to the, if I give you the name of the, it's called higher specialty recruitment, I think. Just a second. Yes. If you just search like higher specialty recruitment, it will take you to a PHST recruitment page. And there is an option called recruitment process. If you click there, then it will basically take you to all this information I have mentioned so far, including the planning of the application. So I think it's very detailed there. Hopefully it will all be clear.
Yeah. It's there. Yeah,
You
thank you.
got that, right? And if you
Yeah,
have other questions, for example, if you're not sure about something, they always mention some email. You can send them email to solve your confusion, and they are actually quite helpful.
Okay.
I have
Thank
also
you. Thank you. Thank you.
shared it in the chat box. If anyone else is in the chat box, the link. All right. Thank you, everyone. I think we
Bye
will
again.
conclude
Bye.
the webinar now. Thank you.
Yeah, thank you. Before closing the meeting, I will wait for 1 or 2 minutes for everybody to go through the email addresses of the speakers and all the links we shared. So goodbye, you all. Have a nice weekend and good night.
Thank you. Bye-bye.